Testicular cancers. Seminoma, the most common type of testicular cancer. It arises from the germ cells of the testicle, that is, the cells important in producing sperm. It is treated with radiotherapy, chemotherapy, or both. Other types of germ cell cancers, which are less common but sometimes more aggressive, can develop in the testes, including embryonal carcinoma, choriocarcinoma, a rare but aggressive cancer, yolk sac tumor. That's yolk sac tumor. This can develop in several areas of the body, but usually in testicles or ovaries. Testicular tumors produce an increased level of human chorionic gonadotropin, abbreviated little h, capital C, capital G, and alpha fetoprotein, AFP. These levels decrease if treatment is successful. Cancer of the testes is most likely to develop between the ages of 15 to 45. Teratoma. This is a heterogeneous growth of mature tissues, such as skin, bone, or hair, which is mostly benign but can be cancerous and can develop within a testicle. Treatment involves surgical removal. Cryptorchidism or cryptorchism. This is a problem where a testicle or testicles become trapped in the abdomen and do not descend into the scrotal sac during fetal development. To correct this problem, orchiopexy is performed to bring a testicle or testicles down into the scrotum from the abdomen. If the problem is not corrected early, the adult male will have an increased risk of infertility and an increased risk of cancer. Anorchism is the failure of one or both testicles to develop. It is a congenital condition. A hydrocele is a sac of clear fluid in a testicle due to infection, tumor, or it may be idiopathic. That is, a reason may not be apparent. Fluid can be needle aspirated or hydrocelectomy can be performed. Ultrasound is used to confirm there is no mass. Testicular torsion is a twisting of the spermatic cord. It can cut off circulation to the testicle. Surgical correction is possible if performed within hours of the first symptoms. Varicocele is a dilated vein or veins of the testicle, associated with azoospermia and oligospermia, that is, a lack of sperm or low sperm counts. Treatment is a varicocelectomy with ligation of the vein at both ends of the varicose vein, then excision of the dilated area. Scrotal pain occurs with a varicocele. Epididymitis is inflammation of the epididymis, often caused by spread of infection from urethra or bladder. Hematospermia is blood in the sperm due to infection somewhere in the urogenital tract. Prostate cancer is a type of adenocarcinoma, cancer of a gland. Early detection is by an increased level of prostate-specific antigen, or PSA, in blood. PSA is produced by a malignant tumor. Later stages can be detected by digital rectal examination, or DRE. Diagnosis is made by needle biopsy of the prostate gland. Several samples are taken through the rectal wall, guided by TRUS, transrectal ultrasound. Computed tomography is used to check for metastases, such as spread of cancer to the lymph nodes. Treatment is multifaceted. Anti-androgen drugs are used to slow tumor growth because the prostate is stimulated to grow in the presence of androgens, which are male sex hormones. Internal radiation can be applied with the use of radioactive quote-unquote seeds. This is called brachytherapy. Brachy means near, or external radiation can be employed. Surgical treatment involves prostatectomy. Benign prostatic hyperplasia, or BPH, is common in Western populations of men older than 50. This is an enlargement of the prostate due to hyperplasia. Hyperplasia is an increase in cell numbers, not just an increase in tissue size or swelling. Hyperplasia is characteristic of tumors, but as the name implies, this is not a cancer, but a benign enlargement. Though not cancerous, the enlargement can interfere with the normal flow of urine from the bladder and may require treatment. In the case of BPH, drugs are used to inhibit a particularly potent type of testosterone. Drugs can also be used to relax the smooth muscles of the prostate and neck of the bladder. Surgically, TURP can be performed, which is transurethral resection of the prostate. This surgery can be by an electrified loop attached to a resectoscope and inserted through the urethra, or by a laser. There is a laser procedure alternative to conventional TURP called a green light PVP, which stands for photoselective vaporization of the prostate. The laser is said to be green in color. This is less invasive than TURP with loop, but can only be used in certain cases. Furthermore, cell overgrowth may recur. A couple other terms that you may encounter regarding cell or tissue growth include hypertrophy and atrophy. Hypertrophy is defined as an increase in cell size. Atrophy is defined as cells that are diminished in size. Disorders and diseases of the penis. Balanitis. Inflammation of the glans penis, which occurs if the foreskin, or prepuce, is not kept clean. Erectile dysfunction, also known as impotence. In this problem, a male is unable to either achieve or maintain an erection long enough to have intercourse. Depending on the exact cause, the problem can be corrected with the use of hormones, medications to improve blood flow to the organ, penile implants, use of ultrasonic waves to improve blood flow, or psychotherapeutic treatment. Priapism, a painful erection which lasts 4 hours or more, can occur in the absence of sexual stimulation or may occur after sexual stimulation has ended. Hypospadias. A congenital disorder where the urethral opening is on the underside of the penis instead of at the tip. Left untreated, this can potentially reduce fertility, but this can be surgically corrected using surrounding tissue or a graft of tissue from elsewhere on the body. Phimosis. Closure of foreskin, or the prepuce, over the head of the penis, the glans penis, due to stricture. Because the head of the penis is unable to emerge from this covering, urine and secretions can accumulate under the stricture in this condition and cause infections. This can be surgically corrected by incising and removing the prepuce. This procedure is called circumcision and is often performed on infant males to prevent the possibility of materials accumulating under the prepuce, whether there is stricture or not. Peyronie's disease is an abnormal curvature of the penis. Treatment of the problem is with drugs to break down the connective tissue which has become scarred. This is a common problem. Castration, which is removal of the testicles, is not a common procedure. Generally, it is not used for fertility control, though it does make a man infertile. However, it may be used to reduce the presence of androgens in the blood in the event of prostate or breast cancer. Oligospermia, azoospermia, and low sperm motility are male fertility problems. In oligospermia, few sperm will be seen on a microscopic slide of semen. In azoospermia, there is a lack of sperm production altogether, and this can be seen microscopically on a slide of semen. Furthermore, a microscopic view of sperm on a slide may reveal problems with sperm motility, which would mean fewer sperm have a chance to make it to a female ovum. Azoospermia can be due to a blockage of the vas deferens. This could be the case after vasectomy or due to prior infection. In these cases, a needle can be inserted through the skin over the epididymis to draw off sperm. Cryptorchidism is another male fertility problem discussed earlier in this module. As mentioned, it involves one or more testicles which do not descend properly into the scrotal sac. Sperm produced in an undescended testicle are not viable. Surgical correction is possible. Erectile dysfunction, also known as impotence, is another male fertility problem discussed earlier. As mentioned, with this problem, a male is unable to either achieve or maintain an erection, and the various medical and psychological options were briefly reviewed. Male birth control. While birth control is not a disease condition, it is worth briefly addressing this issue. Vasectomy is a common option for male birth control. In vasectomy, a small portion of the vas deferens is removed. Vasovasostomy is a procedure to reverse vasectomy. It is more commonly called vasectomy reversal. Another common option for male birth control is the use of condoms. Condoms also help prevent the spread of STDs. This concludes our introduction to male reproductive diseases.